part 3 of the imaging lecture. And this one will focus on the MRI. And as you know, in sequence, we had the first image was plain radiography, then we had CAT scan and all the different features and variations on the different CAT scanning technologies, and this will be on the MRI with all its different features. So, okay, so remember, here's our picture. I want you to think about all the conditions we've discussed so far, and in this MRI section, you should be able to complete your identification of these images. Okay, so there's lots of different indications for magnetic resonance imaging, or MRI. We have trauma. You could see tendons and ligaments really well. So any tendon ligament disorders are well visualized on MRI. Neoplasms, masses, infection, osteonecrosis, complex regional pain syndrome, CRPS, stress fractures, as you see in the teaser image we have here with a nice stress fracture in the calcaneus. And we could look at different regions very well. So in the forefoot, we could look at neuromas, Freiberg, stress fractures, plantar plate injuries, and sesamoid disorders. In the hindfoot, we could look at flexor hallucis longus, tendinitis, plantar fasciitis, osteotrigonum in the ankle, chondral pathology such as osteochondral lesions, and tendons. I want to point out this review that we published in Foot and Ankle International in 2012 with my colleagues at Hopkins, looking at 3T MRI of the ankle. 3T MRI allows us to do a high resolution scan and gives us a faster acquisition of the material. And also we can look more carefully at the structures in finer detail. So these are images of the posterior tib tendon. You could see here the the talonavicular ligament. Here you could see in the arrows the attachment sites of the posterior tib tendon. The attachment sites are usually not well seen because the attachment is on the navicular, which is over here, but here these arrows are showing fine striations of the posterior tib attachment all the way to the other cuneiforms. And this is a part of the spring ligament here. The triangle is demonstrating that. Here is the bifurcate ligament showing the calcaneal origin of the ligament band going to the navicular and a band going to the cuboid. Again, 3T imaging demonstrating a very fine detail of the anatomy. Here we see a Behçet's ligament. We see the syndesmotic ligaments, and we can see the calcaneal fibular ligament here underneath the perineals. This is the posterior talofibular ligament, well seen here. This is the lateral plantar nerve here. This is the medial compartment, the central compartment. This is the central compartment superior, and this is the lateral compartment. Here's a dorsal compartment, and you can see tremendous detail in these images. This is a CAT scan. This is a patient who had a CAT scan, and we could not see a fracture. We were sure this patient had a stress fracture. CAT scan was negative. X-rays were negative. Exquisite tenderness over the anterior process of the calcaneus, and you could see the CAT scan. You could see what the CAT scan could not see, which is the linear line adjacent to the calcaneocuboid, the edema in the anterior portion of the calcaneus. is noted in this MRI. And so on and so forth. These are other images that demonstrate the fine detail of the fibers of the medial complex. And here we have a special cartilage mapping that you could see the different layers of the cartilage on the 3T MRI. So let's look at specific structures now. I just want to emphasize most of these images are 3T. There are some that are 1.5T. Sometimes we get the 1.5T if we have any metal or any artifact, because there'll be less artifact with a 1.5 magnet versus the 3 magnet. So it's not always possible to get the 3, and sometimes you want the 1.5 if we have any internal hardware. Here's the deltoid ligament, and we see the nice fascicles of the deep deltoid ligament. And over here we see the more superficial parts of the posterior tibio-talar ligament, the tibial calcaneal ligament. We can see here ligament attenuation. You see some edema in the medium malleolus here, and we see a loss of the fibrillar striations of the deltoid on the arrow here. And this is the superficial ligament here, but the deep deltoid here looks amorphic. It doesn't look like normal striations. Here on the medial side, we have the posterior tib tendon, the FDL tendon. We have some irregularities on the medial dome of the talus adjacent to the medium malleolus. You see fluid in the joint. We don't see a well-defined anterior talofibular ligament as well. This image has been flipped, but basically shows the edema in the or the change of the signal in the medium malleolus, consistent with some medial malleolar stress reaction. Here we're looking at the lateral collateral ligaments. We're looking at the anterior talofibular ligament here. You can see the posterior talofibular ligament here. And in this image here, you see the posterior talofibular ligament. Here's the fibula, and here's the calcaneal fibular ligament arching over the peroneal tendons. Here we see in an ankle sprain patient a torn anterior talofibular ligament. We see the posterior talofibular ligament that looks also disrupted. There's fluid behind the ankle joint. We see here a torn CFL. So we should see here at the posterior talofibular ligament is you see there's some striations. You don't see a normal thick band. And then we should see the calcaneal fibular ligament coming off the tip of the fibula and diving deep to the peroneal tendons. We lost it in this image. Here we see another case of the torn calcaneal fibular ligament here, and here are the two peroneal tendons, which should be right next to the calcaneal fibular ligament. Just as the tendons go past the tip of the fibula, they're going to be in contact with the calcaneal fibular ligament. Here's a thickened posterior talofibular ligament and a less well-defined anterior talofibular ligament, as you see on this MRI. Here we see a patient with a anterior talofibular ligament, anterior tibiofibular ligament here, and the posterior tibiofibular ligament. These are the anterior and posterior most aspects of the syndesmotic ligaments. And here we see a disruption on the anterior tibiofibular ligament, and the posterior tibiofibular ligament looks intact, but there is some fluid here as well. So there is some concern that this is not in a good condition. Now we're looking at medial malleolar stress fracture and a deltoid tear. This is another one of my patients with who is an athlete, and you see the loss of the normal striations within the deep deltoid. You see the edema in these T2 sequences in the distal tibia on the medial malleolus here. And here you see some of the striations of the deep deltoid. Here you see a little discontinuity as well of the deep fibers, consistent with the diagnosis of medial malleolar stress and a deltoid injury. This is now a Lisfranc injury, and you can see here the Lisfranc ligament. You see some edema around it, but the ligament looks intact here. There is some changes at the bases of the third metatarsal where it meets the lateral cuneiform. Here you see a bone contusion. As I mentioned, we don't see these changes on a CAT scan or an X-ray. And so looking at the trabecular microfractures to see what is going on inside the bone metabolically, you need to get an MRI. This shows this contusion involving almost the entire talus, but mostly from the neck forward. Here's the osteochondral lesion. And this is a very nice 3T sequence. You can see the black line between the cartilage surfaces. That black line is the division between the dorsal and plantar aspect of the joint.